delay with my technical issues. My name is Dr. Ethel Majoko. I am a hospitalist currently with Johns Hopkins Community Physicians in Maryland. And I am 5 years out of residency at this point. If we can go across the panel and just introduce ourselves, please do tell us a little bit about yourselves, where you're from, how you came into MedPeds, and we'll kind of take the conversation from there. Let's start with Dr. Is it Morrow?
Yes, thank you so much. Hi, good afternoon. My name is Ana Mauro. I am born and raised in Buenos Aires, Argentina. I moved to the States when I was 15. I did my medical school in Chicago at the University of Illinois at Chicago, stayed at UIC for internal medicine and pediatrics residency, did an additional chief year in categorical pediatrics. And now I'm faculty in the Department of Academic Internal Medicine as a MedPeds doc here at UIC. I can go into it more, but I don't know if I should wait for everybody else to go and whatnot.
Let's start with the introductions and then we can go around and
awesome, for sure.
how we all came about this path. Thank you, Dr. Morrow. Dr. Granger.
Good evening. My name is Eldecia Granger, and where I'm from is a little complicated. I grew up as a military dependent, so I guess home is where the military sends you. I currently am serving in two different positions. I work as a consultant for federally funded research and development centers, and then the other part of my time I see patients at a clinic in Baltimore. I also provide virtual telehealth care as well. And I did my residency training at UNC Chapel Hill. I came up to Baltimore to do a preventive medicine fellowship and have been in this area for probably about 6 years.
Thank you. Dr. Lightbourne. I think you're still on mute. Okay, can we try Dr. Willis?
Hi, I'm Angelica Willis. I am one of the fourth-year MedPeds residents at the Medical College of Wisconsin. I'm originally from Michigan, did med school at the University of Michigan, and now I'm finishing, or I guess starting my fourth year here. I am applying for MedPeds hospitalist jobs right now as well.
Oh, exciting.
Mm-hmm.
And is it?
I found it.
There we go.
Hi, so my name is Marissa Lightbourne, and I am currently a staff clinician at the NIDDK. I was previously with NICHC, and so I did MedPeds, and then I did a MedPeds endocrinology fellowship as well. And so, so hi everyone.
Nice.
Oh, I guess what I do now, I do clinical research, and I am also involved with the fellowship program and one of the faculty in both adult and pediatrics.
Awesome. And I have, is it Dr. Jourdain?
No.
Soon to be Dr. Jourdain.
Soon to be. I'm a fourth year medical student at Lincoln Memorial, a GO school in Tennessee. And so I'm just interested just to hear what you guys have to offer and just inform me and guide me on this pathway. So thank you guys for, coming and doing this. I feel like I'm the only one on call, so this is gonna be interesting, but thank you. Oh, there's a new person.
We have a couple more joining us, so you're not alone. Thank you for joining us. So this is primarily going to be directed by you guys, Beatrice. So you guys ask the questions and we answer. You've kind of heard our training backgrounds and anything that you want to know from, just the application process, interview process, job search, and actually, finding your niche within MedPeds outside of residency. I think we all can give you some insights into that.
I guess one question would be like, did you guys go in already deciding what you wanted to do? Like one, Dr. Willis says she wants to do MedPeds hospitalist, or did it change? And if it did change, did your program allow for that flexibility?
So to clarify the question, are you speaking specifically about going from medical school to residency, or within residency, if you went into residency with a thought as to where you wanted to go?
Going into residency with thought.
Going into residency. Okay, I can start by just saying that the joy of MedPeds is you can pick anything that you want. So I left medical school going in thinking I wanted to do cardiology. I wanted to do a joint MedPeds cardiology fellowship. While in residency, I fell in love with primary care. You ask, I'm a hospitalist, right? So my background is in global health. I'm originally from Cameroon, so my passion pathway in medicine has been always shifted towards global health. So that's what led me into my residency program at University of Minnesota. While in residency, I did a lot of global health work. So that shifted me into primary care, so to speak, but basically trying to finding local ways of providing global health without necessarily having to travel abroad. So my continuity clinic did a lot of that. That's what led me into primary care. So I had this wonderful idea that I was going to somehow find a clinic that was large enough to fund some of my global health trips while like practicing global health here in the United States. The real world doesn't really work that way. So one of the things that I learned was that I needed to find a clinic that was large enough to be able to support my patient panel while I was abroad. And I was successful in finding that within Hopkins. But what I came to learn was that like there are some financial insinuations in primary care once you're not physically seeing patients. And there are also some complexities about like how much time you can take off. It was just very, very complex. So I then realized, even outside of just practicing global health, that like I loved sick patients. I loved taking care of sick people. So I quickly learned that primary care was not necessarily, at least not in the context that I was practicing, wasn't necessarily what I wanted to do. Hence why I shifted into hospitalist medicine. Now, on the East Coast, it's a little bit challenging to practice med-peds outside of primary care. I went to University of Minnesota where med-peds is everywhere. And it's the same thing with, I think, UNC, because I think I interviewed, like med-peds is everywhere. So whether you wanted to do a fellowship, primary care, hospital medicine, you will find med-peds doctors, you will find hospitals that are willing to cater to that. Negotiating that with employers has been very challenging for me. So what I've had to do is I work primarily as an internal medicine hospitalist while moonlighting as a pediatric hospitalist. So that's my long-winded story. Anybody else want to take it on?
So I think the nicest thing about MedPeds is that you are given a lot of flexibility, and we as a group tend to be people who like pretty much everything. So when I started out, I thought I was going to do primary care or infectious disease. And during my time here, I found that I really liked taking care of super sick patients who are inpatient and having time during the day to kind of come back and see how things changed on the good days where we have time. And for me, having the flexibility to see a little bit of everything, to be able to do ID rotations, to be able to be at my continuity clinic where I am now, to be able to be in the hospital was a fantastic experience. And you kind of find your niche slowly over time. I think that's one of the unique features of residency as a whole, but particularly for MedPeds as well.
Certainly.
Yeah, I would say for me, I definitely went into my MedPeds program. So in undergrad, I was a political science and chemistry major. And so I always kind of knew that I wanted to have that policy piece as a part of what I wanted to do in healthcare. And so when I went into residency, I originally thought I was either going to be a hospitalist or go into primary care. And then I was like, oh, I love combined ID as well. And then when I was there, I really got swept up by the patient safety and the quality bug because I kept seeing things happen. So I became very involved in quality improvement. UNC allows residents to go on special months where you go away from residency for a while to pursue kind of other passions or areas you're interested in. And so while I was there, I had the opportunity to spend time at the IHI, Institute for Healthcare Improvement. I had the time to come up to the Hill to work on policy. And so I think having those experiences, or my residency program allowed me to have those experiences, kind of shaped where I am. But when I walked in the door, I didn't know what was possible. And so that's something that definitely evolved over time for me.
I like what you said, Dr. Granger, about not knowing what's possible, because I think it's true, like there's so much that you can do with MedPeds, right? And so I think it's almost, it's great to kind of really see what the options are available as you sort of go through rotations and kind of meet people that in network. I had a background in public health before going into medical school, and I was able to, I was always interested in like primary care with a public health perspective as well. And so I thought for me, mostly outpatient medicine with some inpatient as well, was a good fit. But I really love, really to create your own ideal future and your own career of choice through MedPeds, all the opportunities that you get.
Hi, so this is, I don't know if she's talking. Okay. All right. So I guess for me, going into MedPeds and choosing peds is that I think I was similar to Ethel in that I was thinking cardiology at first, and I really liked transition cardiology. So I kind of was gravitated towards MedPeds, and a part of me was also very much into wanting to do primary care. And I think what really tipped the scale is that at some point I realized that if you're hardcore, you're MedPeds. There's no one like a MedPeds doctor. And, it just makes you feel proud, like you want to thump your chest and be like, yeah, I'm MedPeds. The surgeons think they're hardcore, but no, we're the real hardcore doctors in medicine. So, I feel like we go through a lot of pressure and we come out truly as diamonds. There's no one as caring or as, and you can just about do anything. That's the other thing about it. Besides just being dedicated and hardworking, it leaves almost every option available when you're done. And you can go back and forth between things. I actually went into pediatric endocrine first. After I gave up my cardiology goals, because how I got there was that I was doing cardiology rotation, I was doing research in cardiology, and almost everybody had diabetes. And I'm like, well, if we can fix the diabetes, we can fix the heart disease. So that's how I ended up back towards endocrine, which is a kind of more like just complicated primary care sometimes. So, but, and I really loved it. And then I did my pediatric endocrine rotation. I loved it even more just because there's so much diversity in what's seen. You never know what's going to come through the door. One time I saw, I literally had a short stature patient followed by a patient with acromegaly. And so the difference was like, wow. And then next patient was like a hirsute women. And I was like, oh, what's going on here? This like never ending interesting things happening. So, it's so nice. My job at NIH, I actually do a lot of hospitalist type work too, because we actually admit to our endocrine service. And so you're actually the hospitalist as well, whether it's peds or adult. So it's a very nice mix of everything for me. I get to be the consultant and I still get to, be a little bit of a hospitalist, a little bit of primary care as well.
Nice. See, that's what's really super exciting about MedPeds. Like everybody has said, there's so much you can explore, and even after you start your career, you can always switch. I mean, I started in primary care. After about a year, I switched to hospital medicine. Now I'm trying to develop another niche for like mother baby care with like breastfeeding things. So there's a lot that you can explore. So if there's one thing I can definitely tell you transitioning into MedPeds residency, don't put too much pressure on yourself.
Yeah, and I did want to touch on something that Dr. Lightbourne said, because, you know, about MedPeds being hardcore. I completely agree for one, but also that was one of the things that attracted me to MedPeds. I was lucky to go to a med school that was affiliated with a MedPeds program, and I found that the doctors that I looked up to the most were the MedPeds physicians. And it's because I think having that mix of internal medicine and pediatrics, you think about things a little bit differently. I think you take care of the patient a little bit differently. I think your differentials are a little bit more expansive. There's things that I bring from peds into taking care of my internal medicine patients and vice versa. So I do think that there is, you know, MedPeds is a little bit of a superpower.
I like that. We have some other participants who joined us. Hello. Hi. So we were just opening up the floor to any questions that you may have from any of our MedPeds docs here. Yeah. If you guys don't have any questions, I may just ramble. So.
Well, I mean, I don't know. I just arrived a little bit late. My name is Moises Auron, and I'm a hospitalist at the Cleveland Clinic main campus. And I'm actually a MedPeds hospitalist. So a little bit of, I mean, if you allow me to do what you told me to do in the email. And so I was actually born and raised in Mexico City. I mean, I came to the United States when I was 29. I was already a board-certified internal medicine physician in Mexico. So I did 4 years internal medicine residency. My brother was doing a pediatric residency here in Metro Health in Cleveland. So during my last year, my senior year of residency, I did research in Metro Health just to explore, I mean, how things look like here. And I came familiarized with what MedPeds was. So when I applied for coming to residency, a little bit of the caveat that perhaps right now will be kind of unacceptable was that I was told very candidly, I would probably appreciate the candid, but I was not necessarily happy about it. They told me, well, look, you look like you're well trained, you have 4 years of medicine in Mexico. However, we have never had a Mexican resident here. Therefore, we don't trust what you bring here. So we would offer you a 3 years residency rather than a 2 years, because for people who were board certified elsewhere, they got an offer for 2 years residency. So for me, it was 3 years. I said, doing 3 years of internal medicine to be again an internist when I trained in an NIH level center in Mexico City. So MedPeds became kind of like a nice choice, because it was the addition of doing pediatrics. And I certainly enjoy the combination of being in the neonatal ICU, then going to the medical ICU, then going to the pediatric ICU, then going to the coronary ICU, then coming to the pediatric floor, then coming to the medicine floor. And then in my I became licensed in medicine in my PGY3. I took my real Ohio license. I was the only one. I was already a real licensed doc as a PGY3. So I was doing a lot of moonlighting in the neonatal ICU, because the moonlighting, unfortunately, worked. So I was doing my internal medicine service of specialty and my nights in the NICU. And I truly, truly love that ability to go all the span. And the way somebody has stated that the way you think in pediatrics, you bring things to medicine. Also, the way you see things as an internist, you bring that to pediatrics. And I mean, I was bringing things for me were second nature, like let's say the BNP, there was no NT-proBNP at the time in the NICU. Why don't we check a BNP in the patient with bronchopulmonary dysplasia? And they were like, wow, that's such a smart quest. That's great. That's awesome. They started shining by asking things that you normally do otherwise, but it is not a common thing. So I finished my MedPeds residency. I joined the Cleveland Clinic as an adult hospitalist, but I normally med-peds, I mean, I think that you are trained to pass both boards at the first time, but a lot of people take one board 1 year, another board another year, but also the fact that each board costs like more than $2,000. I decided to take both at the same time. I was board certified on both. So when I got my PEDS board back, the chairman of pediatric hospital medicine had no spaces for a job. And 6 months later, it opened. And since 2008, I've been doing both. So I'm very lucky. The job I do is an academic inpatient pediatrics and academic inpatient medicine. I'm a core faculty for both internal medicine residency and pediatric hospital medicine fellowship. I'm board certified in pediatric hospital medicine, so that's a subspecialty by itself. And I just joined the American Board of Pediatrics board, sub-board of pediatric hospital medicine. So even as an internist, I'm doing this. So you get the opportunity to contribute to the development of other colleagues. The niche is very impressive. I mean, I was initially interested in doing nephrology or cardiology, but then, I mean, I was always fascinated with every single rotation. But the fact that I do med-peds hospital medicine is great because now with the COVID surge came up, you become a real good stakeholder, take care of all the breadth of patients. And when they were going to move the pediatricians into the adult side, I could have been the stakeholder to help them troubleshoot, the go-to person for questions, and help them manage adult patients comfortably. So this is just a little bit of what I do, and I do find it fascinating. I do not do nursery. I mean, that is not necessarily my cup of tea, but I do acute inpatient care for both medicine and pediatrics. And again, thank you for the opportunity to be here with you guys.
Thank you, Dr. Aron. We really appreciate you making the time to join us. I see a Jayla Bostick that just joined.
Hi, yes, this is Jayla.
Hi, Jayla. Just wanted to
Hi, how are you?
Doing great, thank you. How are you?
I'm good, thank you.
Just wanted to give you an opportunity to introduce yourself and potentially ask your panelists any questions that you may have.
Okay, my name is Jayla again. I am a fourth-year medical student. I go to Touro College of Osteopathic Medicine in Harlem. And the reason why I have my camera off is because I'm driving. I'm just leaving from my shift. So I'm kind of listening in, and I don't have any immediate questions right now, but if I think of any, I'll for sure ask.
Sure, thank you for joining us. Please drive safely. So one thing that I think may be interesting for the medical students is how we came about choosing our various residency programs. So if you guys could go into that a little bit. Let's hear from Dr. Morrow.
Yes, thank you so much. So I was thankful to have an internal medicine and pediatrics program at my institution. And having been there for 4 years, I got the opportunity to work with a variety of faculty and staff within the Med-Peds program that really served a variety of roles, both on the medicine side, on the pediatric side, and really seeing, the hard work of faculty and staff meeting the mission and the vision of my institution was really inspiring, and really these were role models that I was looking up to. And so for me, that was definitely what really drew me to that program. There's also a commitment to addressing health disparities, serving underserved communities, and that is core to my mission. And that is why a combination of all those things really led me to that program.
Awesome, thank you. Dr. Granger?
So I also went to a medical school that had a Med-Peds program. That being said, that is not the program that I chose to go to for residency, even though it was fantastic. I chose UNC Chapel Hill for several reasons. One is I loved the fact that it was a state institution, and I knew that we were really going to see any and everything because we were taking care of everyone in the state. I also love the fact that it was affiliated with, a well-known academic institution, had a school of public health. So you have the opportunities to do research, work with faculty, in the School of Public Health, just to kind of enrich your training experience. The other thing that attracted me, of course, was the notion of special months. I don't know if other residency programs do that, but I do think it's something that's unique to UNC Chapel Hill, that they actually allow you time to do a little bit of career exploration and plan your curriculum and build that into your residency program and part of your training. So I loved that as well. And then I love the diversity of the training. I mean, in the UNC Chapel Hill area, we have hospitals that are, in major cities like in Raleigh. We have hospitals that are more academic based, but then we have hospitals that are further out, and the population is different and the community is different. And I liked the diversity of that population. I knew that it would give me a very well-rounded training. And I love the residents when I went to go interview. So all that led me to choose UNC Chapel Hill.
I'd be interested in hearing from Dr. Willis, who's still kind of embedded in it.
Yes, so this was only a couple years ago for me, so pretty fresh in my memory. When I was looking for a program, I knew that one of the things that was important to me was having a freestanding children's hospital. And it's interesting because Milwaukee really has the only freestanding children's hospital in the state. So we get a lot of patients from all over Wisconsin and even northern Michigan, where I'm from, because it's easier to drive down than to fly over the lake. So I knew that we'd have lots of pediatric patients from all over. And the medicine was balanced as well. But I knew that I also wanted a VA. Because I'm one of the strange people who actually love going to the VA and just dealing with the vets' personalities. It's a really special place and it can be really fun at times. In addition, I trained at a med school with an amazing med-peds program, but I wanted to be in a slightly bigger, more diverse city. And for me, Milwaukee kind of fit the bill. Milwaukee has a slightly colorful history of pretty bad systemic racism. And I felt like training in a place where people looked like me and saw me as their doctor was amazing. And just seeing kids and having their parents be like, see, your doctor looks like you. This is what you can do when you grow up too, was really special. So I feel like what I get from taking care of patients who look like me, I can also give back to the patients that I serve in the community as well.
That's awesome. I love the VA as well. So I think I may be unique in the sense that I came from a non-med-peds medical school. I had no clue what med-peds was up until probably maybe my third year of medical school. So I was going to go into internal medicine, and then I did my pediatric rotation and fell in love. So it just so happened that one of my attendings during my internal medicine rotation was med-peds trained. So she kind of ushered me into med-peds. So I had like this open canvas of med-peds programs to pick from. And what I loved during the interview process was like, I felt like I could relate to just about everybody. Like our interests were very similar. The programs were very they were very open, diverse, people who were interested in activism, people who were interested in social determinants, people who were interested in global health. And like everybody came in with such diverse experiences that just made the residency experience so much richer and fruitful. What led me to University of Minnesota was actually probably one of the last programs I applied to. I just randomly applied because my friends were like, you need to apply to more programs. And I picked a city where I had family, which happened to be Minnesota. I remember going for my interview dinner, driving around the city. I was like, okay, that was my one thing. I need to be able to drive around the city because I get lost very easily. I remember my interview dinner, I clicked with everybody. I mean, they had our residents' wives and children were at the interview dinner. It was such a friendly environment. And one of the biggest pull for me was their very well-established global health program. And also the fact that they they were home to one of the few tropical medicine training fellowship opportunities actually in the world, really. In addition to that, I also loved the fact that they had the only university-based federally qualified healthcare center, where I was able to practice, to explore my global health interests locally. So all of those things combined, and just the people. The people were the biggest thing for me. I mean, everywhere I went, I felt like there was a great community of med-peds physicians and med-peds families. But that program in particular, I felt like checked all the boxes for me. Global health, check. Primary care, check. Diversity, check. All of those things kind of just pulled together for me. So I think, you know, however way you go about looking for your residency program, that feeling they say you get when you find that program, it's real. It's very, very much so real. You just know. Does anybody else want to chime in to the finding your perfect fit for residency?
Sure, I don't mind talking, which is going to be hilarious because I went to University of Minnesota for medical school and I did not pick it for med-peds. So it's very much about your fit. So because I was at Minnesota, I had a really good grasp of what med-peds was and what I wanted and what would make a successful med-peds program for me. And so I, like Angelica, I knew that I wanted a VA experience. Granted, it was not my favorite experience, but I wanted to have that experience. I wanted to be at a children's hospital. I did like that there was a MFM program too, where in Detroit, which is where I ended up going at Wayne State, which is actually connected to the NIH. So their perinatal branch is there. And it had, people don't expect it, but it has a lot of research opportunities, as well as it's one of the most established programs there is for med-peds. The faculty is very diverse. And coming from Minnesota, I really liked seeing a lot of people like me in positions of, of power in the hospital. Like when you look at the president and they're, a person of color, or, it was really nice. And they really took care of you. They took care of their residents. We were very important to just the function of the entire clinic and hospital, and you had a very, very loud voice. In fact, I think almost everyone in that area was something in SNMA, AMSA, this, that, and so you couldn't really help but be propelled in that area. So I think those, and of course, Dr. Ears, he was he's always exciting and to talk to and to be around, and he's just a caring guy. So and the whole entire faculty, it was like him. So it was a big attraction, and I had a blast there. And so with a lot of people just like me, like you say, you find your little group of people and you're like, oh, everyone's so much like me, but at the same time, in a way too, you're diverse. So I should say that as well, because I'm doing research, but then I have other people who are doing things like global health or very immersed in different things like sports medicine, or just a lot of different stories. And I didn't want to be cold anymore, but then I ended up in Michigan and I was still cold. So I guess, I don't know.
The cold is not a game. It's so cold. So cold.
I do want to touch on something that I think a couple of people have said, is the notion of a freestanding children's hospital. I think you have to figure out if that's an important criteria for you, because I do think that there is great benefit from training at a place that has a freestanding children's hospital. And honestly, I think probably a lot of it has to do with like money and budgets. But when you have a freestanding children's hospital, it's treated as thus. And so I think the faculty and the resources are thought about, and that goes into your training. So for me, it was an important factor as well. I wanted to go to some place that actually had like a children's hospital and not just, a couple of wards that were taking care of pediatric patients. So that is something to consider.
I think too with that, if you're thinking about doing a subspecialty, that's probably one of the reasons to want to have a children's hospital, because you're not going to have that exposure elsewhere.
Very true.
Yeah, I mean, one of the things I've been seeing, first of all, in Mexico, there's no med-peds. And when people understand that I'm med-peds, they say, no, you cannot be med-peds. How can that happen? So anyway, so when I found that med-peds existed, and I found it really fascinating, because the med-peds residents, they were doing interesting things. I mean, a lot of international travel, they were doing tropical medicine. Some of them, as you have stated, doing sports medicine. Some people were actually doing both. There's a few med-peds nephrologists, med-peds ID docs. And Metro Health is actually the place where med-peds was born. So I was in a county hospital in Cleveland, Ohio, where they actually had one of the pioneer programs in the United States. And everybody was really proud of it. And also the diversity of residents was really brutal. I mean, we have residents from Africa, we have residents from India, from Afghanistan, from Pakistan. I was actually the first Latin resident, which I opened the doors for many other ones. Actually, my wife coming after me. And like I've told you, I just experienced that candid statement, oh, you're coming from Mexico, we'll offer you 3 years. Like, why? Well, because we don't really trust you guys. So it was an interesting thing. But nonetheless, I mean, once you go into the program, it's really fascinating, and the exposure is very diverse. Now, it's not a freestanding pediatric hospital. However, it has a very robust outpatient pediatric practice and a very robust med-peds practice too. And the inpatient wards, they have a very busy inpatient wards for both children with complex needs and kids with regular bread-and-butter problems, and a very level 3 NICU, and also pediatric ICU is actually one of the pediatric centers for trauma. I mean, right now we have 2. We have Rainbow, but at that time it was the only pediatric center for trauma in Northeast Ohio. So that was fascinating. Now, let me just tell you that if you are a med-peds, like a hospitalist, like I am, I had to do the pleasure of doing some mentoring for some hospitalists from Northwestern in Chicago. And interestingly, they work in the freestanding children's hospital, and the chairman of pediatric hospital medicine is unwilling to sign their document that they need to take to become board certified in pediatric hospital medicine, because according to his criteria, they are not spending a lot of time, although when you look at things, they do meet the criteria. So I would just be kind of very always cautious where you end up working with, because of an element that can become barriers for your own professional development. So I do not work in a freestanding pediatric hospital. I work with Cleveland Clinic Children's, which is within the Cleveland Clinic. It has a very large single building just for outpatient. But now I'm becoming an officer for the American Board of Pediatrics, for the sub-board of hospital. So you need to gauge things, because things may look nicer when you're in a freestanding hospital medicine, pediatric hospital medicine, but probably your professional development may not be as successful as you can think it will be.
You know, that's a good point. That's why it's so very important for you to, it's important to know what your interests are, but it's also important to look into the programs. And I think that's where talking to residents from that program, I mean, because anything on first look can look very glossy, right? It's important. I remember one of my interviews, nice program, very welcoming, seemed like it would be a good fit. And, you know, I spoke to the first year residents, they were tired. You know, like residency is tiring, but they seemed very much so overworked. And they're like, yeah, you know, we work hard, but we still get to go out. And like, I'm like, but you look like you are going through it. So those little things are important. Like find somebody who may have an interest or may know a little bit of something about what you may be interested in, to see if you can explore that pathway. But also keep in mind that the residency experience in and of itself can completely change your pathway, completely.
And I just
No,
want to,
you're absolutely right.
I was just going to put a plug in that if you haven't checked out the National Med-Peds Residency Association website, it's actually a wonderful resource. They have tons of information there. They've actually been featuring webinars with programs all summer. They recognize that we're in the middle of COVID, so there's plenty of opportunities for you to be able to reach out to program directors and people who can connect you to fellow residents and programs. So I would definitely check that out as a resource as well.
And honestly, the program directors across the board are super awesome. They're
Yeah.
all very open, very willing to tell you that, like, hey, this is what my program is great for. This is what we don't do very great at. This, you know, so that's another reason why I just love the MedPeds community, because it's such an open, inviting, and welcoming community. But you have to be very honest with yourself about what you want out of your residency experience.
And in my experience, residents don't tend to sugarcoat. So when they tell you things, it is probably the truth. I know I'm very upfront about answering people's questions. So, and I think that most of the MedPeds residents in general are pretty blunt. So I think you'll get your answers.
No one wants to get there and have people leave. That's more a call for you.
I'm sorry, you're muted.
Do we have any more questions from the attendees? Beatrice, Jayla?
I think that one of the important things also, I mean, based on what you want, for instance, like Dr. Lightburn, I mean, she's an NIH recognized pediatric endocrinologist. I mean, it's just, we're lucky to be, I want to get a screenshot to say that I was in the same meeting with you, by the way. So, I mean, this is research at the highest level as it can be. And there's an opportunity for mentoring there. And the beauty of MedPeds is that you have the breadth of doing these across the whole specialty. I think that sometimes, I mean, the research that happened in pediatrics was very high level. And I mean, the pediatric fellowship, those are 3 years. And it's hard to get into because one of the years is basically entirely dedicated to very well done research. So I think that the beauty of MedPeds is that provides you the chance of doing research that can encompass all the whole spectrum of this, and certainly the internal medicine experience gives you a lot of expertise for that if you develop interest in research.
That's great. The whole, you know, I think everybody here, please, I hope I'm not throwing you all under the bus, but I think everybody here would probably be willing to chat some more, even outside of this meeting. If you guys have any more questions, if, you know, something like piques your interest in a couple of months, and you're like, hey, I was on this webinar, maybe I should hit up one of those doctors. Please feel free to do so. We're all open. We're very willing. We understand that it's a process, especially in the middle of a pandemic. Have some unique challenges that we may not have had during our time, but you know, again, this is it's a challenging time for all of us, so we're all in it together. Is there anything else that you all thought that we should bring up during this panel that we may not have touched on just yet? I think we've touched on research.
What I was going to add is to make sure that you take a look at what the clinical experience looks like, because the clinical experience can vary across MedPeds programs. Some clinics are, you know, MedPeds clinics, they're staffed only by MedPeds residents. Some clinics, you know, people rotate between pediatric clinic and internal medicine clinic. So make sure that when you're looking at programs that you consider where it is that you're going to best thrive and what type of outpatient clinical environment you may like, particularly if you're interested in going into primary care.
And also to add to that, it's important to figure out how like hospitalist heavy either side of each program is. So you may have like a solid outpatient experience, but the hospitalist experience may be a little finicky. So all of those things are really important. I mean, like I said, it's important to have a well-rounded experience, but it all depends on you, right? Like if you already know from jump that you want to do hospital medicine, then you look for a program that is heavy on hospital medicine. If you already know primary care is where you want to be, I think personally, I think it's important to find a program that has med peds preceptors. I think it's really difficult to jump between like pediatric and medicine clinics. Finding a clinic that you can do both is invaluable, but it doesn't necessarily mean that you're not going to get a great experience practicing in sometimes pediatric clinic or sometimes just medicine clinics. It just depends on what you're comfortable with and kind of how you envision your residency experience.
And I think that one of the other important things to think about is that the program that is right for you may not be right for those around you. So as med peds residents, attendings, practitioners, we're all very different people and we all had different needs going into residency. So the program that you love may not be, you know, the one that's ranked #1 in whatever ranking system came out that week, but it might be the perfect program for you. So just make sure that you stay really open and that you are searching for the group of people who you fit with and who will support you, because you'll have life things happen during residency. You'll have a lot of things go on, and you want to make sure that you're around a group of people who will support you, who will go to bat for you, and who are able to find the resources that you need to be successful. So don't base everything on the rankings, just find the best fit for yourself.
Not to say all the advice so far has not been great, but I think that's probably #1 on my list. Individualize your interview experience, individualize your ranking. You don't want to end up in a program that you hate. You can never be 100% certain, but like I said, that feeling inside, like, you know, I found the environment in Minnesota to be very, you know, welcoming, and Dr. Lighthouse felt differently, you know. So just I think that's the #1. If I were to rank different things that you should look for in a program, that's the #1. Like, you need to be supported. You need to be in an environment where you can thrive, either, you know, not only professionally, but personally as well, because life doesn't stop because you're in residency. All right.
I want to say something also. Yeah. Oh, sorry about that.
No, please go ahead.
I mean, the fact that you have met these preceptors is very important, because they have that experience and that mindset to go back and forth and give you the flexibility in the way you think. You also need to understand, I mean, where do you want to see yourself in 5 or 6 or 10 years after residency? And I also believe that you try to get a program. I mean, for instance, I was always interested in doing some networking, going to national meeting, network, be part of the organizing committee. And I mean, I was at some point the chair of the Council of Early Career Physicians for the ACP, and I was sitting in the Board of Regents. And I am now a candidate for becoming a governor for ACP Ohio chapter. So is that something that your program will help you to develop those skills, or that's a skill set that you need to have on your own, where you have to go elsewhere? And I say this because those are 4 years of training. I mean, it's just, if you are, I mean, if you are 40 years old, well, that's basically 10% of your life. So it's really meaningful time, and you want to hone your skills clinically, be super internist, a super pediatrician, but also if you want to thrive beyond that, a hostel that allows you to get that mentorship is very important. And I mean, the staff that trained me, I actually asked for specific training with the Dr. Zaprano, that he works in the community. He works in East Cleveland, seeing a very challenging population. That was the most fascinating year I had. I enjoyed so much. And although he is not in directive positions in national meetings, the way he thinks, the way he organizes things, the way he does things, he's a true leader, and I learned from him. So it's always important to acknowledge that organizational capacity and think out of the box to help others.
I love that. It looks like we're coming up to the end of the hour. I think the panelists have been very forthcoming, and I thank you all for your time. Thank you to our attendees, and I hope everybody can get something out of this meeting. If there's nothing else from our panelists, I'd like to call the meeting to a close.
It was nice meeting everyone.
Likewise, I love the MedPeds community always.
Thank you guys. I truly appreciate it.
Take care. Thank you for the invitation. Nice to meet you all.
Thank you.